Hello and happy holidays. I'm Alexis Del Cid. We're taking the winter holidays to spend some much needed time with our loved ones, and we hope you are as well. Until we return, please enjoy this Encore presentation of all things brain health. Good morning, I'm Alexis Del Cid. Welcome to our debut episode of All Things Brain Health, our new series. From memory problems, solving problems, to emotional well-being and motor function. If you think it or feel it, we will talk about it right here. Today we're focused on concussions. And yes, athletes are at risk, we know that. But did you know concussions are more likely to happen from a fall or an accident? And what happens to your brain during a concussion? What are the long-term effects of a concussion? Today, we talk about that, and we share a clinical study that tested a surprising potential treatment for concussions. Could a hunger hormone help the brain heal? But first, let's hear from a woman who learned that recovering from a concussion can be a long process.
So I sleep on this side, and I must have gotten up because I don't remember any of this.
It was around 4 in the morning, shortly before Christmas, when Gail Eckert got out of bed.
I heard a loud crash and immediately reached over, and Gail wasn't in the bed.
Her husband Tom found her unresponsive and called 911 for help.
And after just a few seconds, he says, "You need to start CPR."
Gail was rushed to a local hospital. Doctors never solved why she passed out. MRIs and other tests didn't reveal any problems. But there was a problem when she woke up in her hospital bed.
What in the world am I doing here? And I saw two of them, and it was, I was like, man, this is not right. And
other concerns soon followed, like memory, decision-making, and balance.
She couldn't walk a straight line.
I couldn't walk a straight line. I was dizzy.
Walking up a flight of stairs was tricky.
The thing that was really bad was I couldn't drive.
Try to catch as close to you as you can.
Gail went to the Center for Concussion Management at the University of Kansas Health System.
Okay, you can hit that when you're ready.
She began working with vestibular physical therapist Bill Condon.
There you go. Good.
He's shown here working with another patient.
You're doing great.
Bill was remarkable. He just put me at ease. He put Tom at ease.
They included me in all of this. Bill would look at me when, "Is she better?"
Ready?
Exercises are individualized.
There we go.
Therapy takes place inside the health system and at home.
We would put Post-it notes on here with the numbers on them. And there were 6 of them. 2, 3, 4. So there were all these numbers on here.
Gail showed us the exercises that challenged her memory and balance.
I had 30 seconds to read these numbers.
Today she's much better, and this couple has a new appreciation for how serious concussions are and how long symptoms last.
I didn't appreciate just how big of an impact, how serious this was, and the impact that it can do to you until I saw what it did to my wife. And it's not something that gets better in a week. And she wasn't back on the field the next Saturday.
We are so happy to have Gail in the studio with us this morning. Gail, thank you for being here.
Thank you for asking me.
How are you feeling physically this morning?
Physically, I'm good today.
Physically, emotionally, it's been a kind of stressful sitting down doing your first TV appearance,
Yes.
But you're doing great so far.
Thank you. Appreciate that.
And we also have the multidisciplinary team that helped manage Gail's concussion. We have Dr. Michael Rippey, who is a sports neurologist and the medical director for the Center for Concussion Management here at the University of Kansas Health System. We have Bill Condon. Bill is the physical therapist who you saw in the video about Gail, who has special training in vestibular therapy. And we have Courtney King. Courtney is a speech and language pathologist who also worked with Gail. So we have the whole team here. Really great to have you all joining us this morning. Now, Dr. Rippey, we know a concussion comes from a hard hit to the head. What exactly is happening inside the head to the brain during a concussion?
Yeah, so the brain, right, it moves around, and I like to say it's inside a hard box, right, which is great in protecting the brain, but also gives it a hard box to knock up against when you hit your head. And so those brain cells, those neurons, they're kind of like electrical cords, and they get stretched and they get twisted and they get kind of pulled apart. And when that happens, it creates this whole series of chemical changes that cause the brain cells to sort of stop functioning the way they should.
So it's the brain moving around inside our skull.
It is.
That
It's
is
the brain moving
concussion.
around.
Why do some people recover from concussions rather quickly, and then other people can have symptoms? Some people have symptoms for years.
Yeah, I think there's a lot we still don't know about why that happens. You're right, up to 80% of people are better in about 6 weeks. But we do have those patients that will have symptoms, and there's risk factors. We know patients with migraines tend to recover slower, and there's other things. But for a lot of times, we just don't know why. The vestibular symptoms that that Bill treated are one that can also last for a while.
That's quite a visual we were showing our audience there of the brain. That's how the brain moves inside the head.
Yeah.
Like, Gail, what's it like to see that kind of a video?
Shocking.
Right.
It is.
And how long from when you had your fall, how much time passed between that and you finally being able to get the therapy that you needed?
19 days.
So
I counted it out. That was pretty good because I had a hard time finding appointments. And I was referred to the KU Concussion Clinic. I don't know if that's what you guys call it or not, but by a nurse anesthetist and a nurse practitioner. And it was the best advice I've ever had.
Dr. Rippey, do you call it the Concussion Clinic?
Yeah,
Is that
absolutely.
the name? The University of Kansas Health System Concussion Clinic?
Yeah.
Well, thank goodness you got in here.
Yes.
What were those 19 days like? The symptoms sound terrible. Did I hear you correctly in the video? You said I saw 2 of them. Did you mean the doctors were all in double when they were coming in?
When I woke up, everybody was double. Everything was double.
Oh my goodness.
And that was no fun.
And
It went away at about day 10, day 12, something like that. It just gradually went away, and then I was just seeing one thing. But that was really
balance problems, trouble
balance
thinking?
problems. I couldn't walk a straight line. People had to hang on to me. I didn't realize I was listing, but I was. So that was hard.
That must have been so upsetting as your husband. That must have been so upsetting for him to see.
I think he was upset. Yes.
Yeah. Did it affect your sleep?
No, heck no. I slept a
good.
lot. I took a lot of naps.
And Bill, Gail spent 4 months working with you, more than 4 months. We have some video of Bill with another patient going through vestibular therapy. What do you do in vestibular physical therapy?
So primarily we assess, first we assess the central vestibular system, so the brain-eye connection. And how we do that is look at eye movements and eye head movements, and we look to see if anything looks out of the ordinary or if they're symptomatic with those movements. And then we focus on that in treatment. And whatever we see as a problem, we focus on that, trying to get the brain to kind of habituate to those movements. And then we also look at balance, which Gail had said was an issue for her. So we have tests that we do to assess her balance and then really work on her balance.
Physically, Gail, what was that kind of therapy like when you were done with a long therapy session?
I enjoyed therapy, mainly because I knew you were working to get me better. And so I tried to comply with everything you told me to do. My homework, you gave me homework to do.
What was the homework?
The little sticky things that you put on the wall, and you had to stand 6 feet back, which we measured, made sure. And we just, and so I worked on those every day to make, I think 2 or 3 times a day to begin with, based on your advice. And so by the time I accomplished that, I was doing better. So
when did you, how many days passed from the time you started therapy till you started to think, okay, I'm getting better, this is working?
Well, probably about halfway through, I was able to accomplish a lot of the things that these 2 gave me to do.
So about 2 months in?
Yeah.
A lot of her symptoms improved about halfway through, like dizziness was the main one. And then from then we worked more on balance.
And that's how you measure the success?
Yeah, we have outcome measures we use. So we have a dizziness handicap inventory that we used with her to measure how her dizziness is. And then we have specific balance tests that we use to assess, and we can track her progress. And
Courtney, I'm going to get to you in 1 second about the kind of speech therapy you did. How closely are you connecting with Dr. Rippey when you're monitoring Gail's progress?
Closely, we're fortunate to have Dr. Rippey, a close relationship with Dr. Rippey. I work with 2 other vestibular therapists as well, Marie and Claude, and we're lucky to have Dr. Rippey as the head of our team. So we communicate with him frequently via email, give him updates. We have monthly concussion rounds, which are great, so we can all get on the same page with treatment plans.
Courtney, you were Gail's speech therapist. When most of us hear speech therapy, we think pronunciation practice, the movement of the palate, the lips, the tongue, the mouth. What happens when you're doing speech therapy for a concussion patient?
Well, yeah, thank you for saying that, because sometimes the first thing patients will say when they get into my office is like, I don't really know why my doctor referred me here. I'm not having speech issues.
Right.
And so that's my chance to say, okay, well, in the hospital setting, a speech therapist, yes, will sometimes work to evaluate and treat motor speech issues, but we also, have our other hats we wear. And in concussion recovery, that we're working on the cognitive piece of things. And so oftentimes what we see that can go awry with after concussion is the thinking skills. And that can include things like executive functioning, so planning, organizing, problem solving, things like memory or attention skills.
So speech therapy works on things that have nothing to do with how the words sound
Exactly.
coming out of the mouth.
Yep, we can work on that just depending on someone's diagnosis. But yeah, in brain injury and concussion recovery, we're working on the cognitive piece of things.
And so what did that look like with Gail? How did you see that she was having a cognitive communication problem?
Well, first, Gail was patient with me and let me put her through some testing, so that way we could see what is the brain doing really, really well, and are there any areas that we need to address in therapy? And very quickly, we saw Gail's memory was stellar, very, very strong memory. It was just the high-level attention piece of things, specifically with divided attention. So when Gail had to multitask, and especially if she was around a lot of distractions, so also that selective attention, then her brain would have a little bit more difficulty. And so that's what we knew. We kind of had the roadmap after testing of what to work on.
So when you measure progress, what did that look like with Gail then?
Yeah, so sometimes we do some retesting, but when we're going through different treatment activities and things, I'm seeing, okay, how is she doing? What's her accuracy with some of these different treatment tasks? And I also like to, hear a patient's perspective on, are they noticing that work is going smoother?
Right.
What are they noticing outside of therapy? And that gives me a nice indication too of how that brain is doing.
I want to ask Gail, I got to ask you this. I know that you mentioned before the show started that you retired a few years ago, but some of the stressful things in life are outside of work, like just going to the grocery store. I want to ask you about, there's a lot of sensory input, you're fiddling for your credit card, there's a line, or if you're doing, God forbid, self-checkout, that can be a nightmare of its own. What were
I
those?
don't do that.
Before or after your concussion? Never. Right. It's stressful, the line builds. What was it like for you doing day-to-day things while you're recovering from a concussion?
Well, I was very lucky to have my husband with me most of the time. He does have a shop that he works at the afternoon, but I was very lucky to have my family around, and my son and daughter and their spouses. They all helped me. So I was able to, I didn't have to do a lot of the stuff that I normally have to do. They did it for me.
Could you drive?
No, I don't remember who told me not to drive, but
it was good advice. Right?
but I was very glad when Dr. Rippey said I could drive.
How long did it take Dr. Rippey before Gail could drive again? How long into
I honestly
her
don't
treatment?
remember.
I think we saw you on February 23rd, and I asked you if I could drive, and you said yes, and I was like, okay, good, yay!
Yeah.
I can go back to Zumba classes. I can go to the grocery store. I can do those things that my family were having to do for me.
Is this standard of care that is the care Gail got standard for all concussions?
I would say, yeah. I mean, very, very early on, right? That first week or so, we talk a lot about rest. But other than that, yeah, I would say it's very standard. Vestibular therapy is like I feel like I'm a vestibular therapist. I've learned so much from our group, speech therapy. Yeah, I would say these are really standard things that we do with our concussion patients.
I want to talk about this clinical trial that you oversaw. This is so interesting because the trial Dr. Rippey was involved in looked at a treatment for concussion using a stomach hormone called Ghrelin. It's also known as the hunger hormone. What made you even think that using a hunger hormone from the stomach hormone could work treating concussions?
Well, I'd love to take the credit for that initial thought. It was definitely through some colleagues, Vishal Bansal, who's one of the co-authors on the study, did a lot of the basic science research, and it makes some sense when you really kind of step back and think about it. I would love to say I would have thought of it. I'm not sure I ever would have, but it's a hormone that works in the brain to tell your brain whether you're hungry or not hungry. And so people started looking at it and saying, well, what else does it do in the brain? And they discovered it helps with inflammation, with protecting those nerve cells, with helping them communicate better with each other. And so as they started doing that research, they found, well, these are things that happen a lot in concussions. And so, hey, maybe this will help improve that.
So interesting. You talk about something called neurometabolic dysfunction. To someone with no medical background, what is neurometabolic dysfunction?
I think the best way to think about it is we call it an energy crisis. So when we talk about that brain injury, that nerve cell is really unable to make its own energy again. So it's really starving for that energy to do its normal functions. And the whole point is to restore that normal energy function in order to restore normal function of that nerve cell.
So in this trial, participants injected Ghrelin at home for 2 weeks. Where in their body do they inject it?
Most of the time it was in their abdomen. They could theoretically do it in their thigh, but I think most people chose to do it in their abdomen.
And what were the kinds of changes you observed? And then while you answer that question, we want to show our viewers a graphic showing some of the results from this trial. What were the changes you observed?
Yeah, so what we really focused on was how was a patient feeling, right? And so we had sort of two things. On the left here, you'll kind of see what we call the PCSS, or post-concussion symptom scale, and that's literally measuring how bothersome a symptom is. You know, is it a headache? Is it dizziness? Is it memory problems? And on the right, you'll see quality of life. How's your life, right? What's your quality of life in this situation? And on top of these two graphs, you'll see the group that was treated with Ghrelin.
Right.
On the bottom, you'll see the groups that were standard of care, vestibular therapy, speech therapy.
Oh, interesting.
And we measured them. We measured them at multiple time points, but we really focused on day 1, the start of the study, day 15, which was the end of the treatment portion, the 2 weeks, and then day 44, which was the end of the study. So we monitored them for another few weeks after they stopped the treatment. And you can see on top the groups that were treated, their symptom scores continued to trend down throughout the trial versus the group that was standard of care and was pretty flat. They kind of stayed the same.
What would it take for this to become an approved treatment in the future?
So the first caution is this is a very small study. We had just a little over 20 patients, and so we definitely can't make wide sweeping claims about this, but it's going to require a much bigger study, multi-centered, multiple patients, probably hundreds of patients, and it's going to require FDA approval eventually.
That's why these studies are so important. It's so important people take part in your studies.
Yeah, absolutely. And we discovered it's always hard to find study participants, especially when you start talking about injecting something.
Right.
But yeah, these studies help us hopefully someday, have a treatment for this.
That would be incredible.
It would be.
We love getting our viewer questions. You can always send any questions or comments to us. You can send them in real time. We'll read them on the show. You can use the chat on YouTube or Facebook, and that information on how you can connect with us is right there on your screen. Now, Dr. Rippey, you're a sports neurologist, but as we're learning, so many people like Gail suffer concussions outside of sports. We have a list of some of the most common causes. Take a look at this. It's falls, yes, car crashes, sports, violence, and other accidents that involve a knock to the head. How common is it for you, Dr. Rippey, to treat concussion patients injured in these other ways?
It's very common. I love sports, and I would love to say all I see are athletes, but I would say that's actually the minority of what I see. It's much more of these falls, the car accidents, winters. I like to say good for business.
Oh gosh, yeah.
Yeah, and I hear all kinds of stories. I joke with my family. it's pretty frequent that I hear a story. I go, I've never heard that one before. So
You have 5 kids. You must have a lot of helmets in your house.
yes, my kids' friends know that if they come to my house, they have to wear a helmet if they're on their scooter or their bike.
They just wear the helmet the whole time they're at your house.
We have extra helmets.
Not on my watch.
We have extra helmets. My daughters did horseback riding for a while. That was the
Yeah.
first thing we bought was the helmet. So yes, lots of helmets.
Obviously, smart. Gail, are you still dealing with any symptoms?
I still have trouble with memory, and I still have trouble with balance. But I think that could be too, based on my age. I turned 74 in July, so
You look incredible.
Well, thank you, but I think that's much better. I was way not good with the balance and memory before, and so I'm much better.
Well, and there's another reason she looks incredible is because she's very active. In fact, Gail, you just got back to doing your Zumba classes.
I did.
Here you are busting out your moves in Zumba. What does Zumba mean to you?
It's camaraderie. Even though nobody cares what you do in Zumba, you just keep moving. They don't care if you are doing what the instructor's doing. You just do it. So I hadn't really told anybody that I had a concussion until the day I asked the lady to do my video on her phone, and then everybody wanted to know what was wrong with me. So I had to take like 5 minutes and tell everybody,
Explain it.
and so that was interesting. And then everybody else had to tell me all their concussion stories. So
All their concussion stories. So
not them necessarily,
Yeah.
but their family or somebody that had a concussion and how they took care of them.
So that many people that you didn't even know that well had experienced some sort of concussion or someone they loved.
And there's between
Have
30
one.
and 40 people
Right.
that go to these classes. So
And
there's
most
a
people
lot.
had a story. Wow, well that's
Yeah.
super interesting. You've also made some changes to your home. Your husband installed some motion activated lights so that you obviously helps you see where you're going. Any other big changes that you made?
Not really. I don't think we've made a lot of changes. We live on a hill, so we have 12 steps in no matter where you're you're entering or leaving the house. So they made sure I didn't do that by myself in the first few weeks, and then I could do it by myself. So but no changes.
Do you still feel like everyone's treating you like glass, like you're an eggshell?
Oh golly, yes.
Is that frustrating?
Especially my kids. They're like, "Mom, are you okay?" And I'm like, "Yes, I'm fine." But I'm not going to make you dinner today. You have to take me out.
Play that card as much as you can.
Yes.
What would you say to someone who's watching this, who's feeling like they're really in the weeds, dealing with these post-concussion symptoms, feeling stuck?
I say, first off, you need to get in with this team. That was the best thing that ever happened to me. And just take their advice, follow what you're told to do, and be evaluated on a regular basis, and eventually you'll get better.
Get in with this team, most importantly.
Yes.
We do have some viewer questions coming in, and as you send those in, I actually have a question for Dr. Rippey, because back years before I was born, when my dad was really young, he would always tell this story that when he was a teenager, he was water skiing, took a really hard fall to hit his head, and then he walked into, kind of stumbled into a friend's house and slept for 10 hours in the middle of the day. So clearly he was concussed. They just said he got his bell rung and no one talked about it. Could that have had long-term lasting damage on him?
It could have, yeah. I mean, it sounds like most patients, he recovered pretty well, but yeah, I mean, the old "I rung my bell," it's a concussion.
That's a thing. What should have happened? What was available back in the 50s and 60s?
Right. I mean, he probably did the right thing. He rested and luckily felt better. It sounds like within a day or two. So that's the very first thing, is just sort of take a step back, rest. Don't put yourself in harm's way again. And if it recovers quickly, then you can move on.
How new is this concussion protocol?
I don't know. It feels new, but it's probably not. It feels old at the same time. I don't know.
Yeah.
I feel we've been doing it for 10 or 15 years now.
Yeah.
But people who had had this happen 20 years ago.
Yeah, I mean,
Probably wouldn't have these
20
things
years ago it
available.
was go sit in a dark room and don't come out till you feel better.
That might be a while for a lot of people. We want to go to some of the questions from our viewers. Marie wants to know, is it possible to recover 100% from a concussion, or is there always some kind of lingering damage?
I guess I'll take that
Take
one.
that, yeah.
I would say, yeah, most patients 100% recover. I usually tell patients, you're going to stick this in the rearview mirror and forget about us and move on with life.
You love your patients, but you'd rather they forget about you.
Oh, I say that every.
Right?
I would say I probably said this to you. No offense, I don't want to see you again.
We did say that. And I was like, okay,
And
me
Gail
either.
probably said that to us.
Yeah.
Like,
Yeah.
hey, we're done here.
Is this the first time you've all seen each other in quite a while then?
Yes.
Yes, April.
Nice.
Which
Let's
is
keep it that
exciting
way.
to see it, you know, Gail, and now that she's feeling better and see her nice and recovered.
Back to herself. Gene Reardon has a question. He wants to know, is there any similarity for concussions and treatment for strokes? I have a friend who has lost memory from a stroke. I'm going to start with Courtney.
Yeah, so a lot of the testing and the treatment looks the same. You know, there are different modalities of insult to the brain, but yeah, a lot of that treatment looks the same. Yet it's all very individualized to the patient. So, you know, we kind of take a look at what are their types of duties outside of the home, or like, are they working, and we want to get them back to doing all of those things. But yeah, a lot of the testing and the treatments may look very similar, despite them being different modalities of injury.
Bill, you looked like you wanted to say something there.
No, I mean, I would say for PT, it can look pretty different, the therapy, unless, I guess it's dependent on the part of the brain that's affected in the stroke. If it's like a cerebellar stroke where they might be having some dizziness, they might need some vestibular therapy, but otherwise, it looks pretty different, I'd say, for PT.
Dr. Rippey?
Yeah, I think there's definitely some similar. I come from a stroke background. That was my original training.
Right.
So I can't say I knew Courtney before, but her colleague Jamie and I go way back to when we were both working inpatient and taking care of stroke patients. So there's definitely some overlap, but as Bill said, there's definitely some very different aspects too.
Do you think Ghrelin could, the study is new and you said limited, but could it help patients post-concussion well into the future, or is it just an immediately after concussion?
Yeah, we don't know that, and that's part of, as a team, as we've looked at future studies, we've talked about, you know, we want to start with this very narrow group in the early stages, but we do want to look at those patients who have lingering symptoms that are ongoing and can that help these folks too.
This has been such an incredible discussion, Gail. Again, so glad you're feeling better. We have some final thoughts that we'd love to get to you to. And Bill, what's the one thing you want people watching to know?
Sure, can I have two things?
Yes, you're allowed to. Yes.
One thing is, I just think it's really important to try to get patients who've sustained a concussion into therapy as soon as possible. So, you know, Gail was able to get in early, which is great. And Christy Hatfield, who's our concussion clinic coordinator, has been really good about getting patients in as soon as possible to therapy. So I think that's super important. I think Gail found that helpful too, to get in early. The other thing is, you know, I want to just say Gail was, you know, great to work with. She was fun to work with. She was great about doing her homework. So, I mean, that's the main reason she's a success story.
A+. An A+ student.
Yes.
Courtney, what would you like our viewers to know?
I definitely agree with Bill. Like if you're kind of in the midst of some prolonged concussion symptoms and you're alone with that, it's, you know, you don't need to be. You can come in and you can seek help for that from a neurologist such as Dr. Rippey, from therapists. And then just from the cognitive standpoint, these, you know, if you're experiencing cognitive changes after concussion, boy, that can be really, really frustrating, really anxiety provoking for people. And so I would just say approach that brain with a lot of grace and patience as it heals. I think it's intuitive for us to sometimes get mad at that brain when it's not doing what we want it to do and what we expect it to do. But I find when patients tend to approach therapy with a lot of grace and patience for their brain, it just goes a little bit smoother.
Right.
Just knowing, okay, my brain's working on healing.
Go easy on yourself.
Go easy on yourself, absolutely.
Dr. Rippey, what about you?
They kind of stole mine. No, you're right. It's seeking that treatment. You know, if it gets better in a day or two, you never call anyone. But we get a lot of patients that say, I've suffered with this for 4 months, 6 months, and I didn't know where to go or what to do, and I couldn't get in to see anyone. And so, yeah, there's lots of resources out there, whether it's our website, which can at least get you started, and then go from there.
Gail, anything you'd like our viewers to know?
I'm just very grateful that I had a team that took me on and walked me through everything, and I've ended up on the good side of things.
Back to your Zumba, back to your
Yes, back to
friends.
Zumba. My family was wonderful. They took good care of me, and I appreciate all of that as well.
Well, thank you for taking the time to come in here and join the discussion. Thank you to all of our experts here on the panel.